Gen AI is exploding. Okay, everybody's talking about Gen AI, and it has great applications into the medical field. And we've just done a workshop about that. We've used it to look at medical records and ask questions about those patients. That's one thing that's, I think, the most hyped, but also with time, we'll find a lot of applications for this technology. Another thing that's happening is everything to do with computer vision, especially when you look at endoscopy and also digital pathologies. These things are very, very impactful. They're going to save a lot of time, improve the accuracy. Then there's traditional machine learning, everything to do with the labs, all of the structured data, and being able to use that data to predictions on a specific patient population. Now, I think the real exponential growth comes from actually being able to integrate those three aspects together, text and everything to do with language models, the medical imaging, and also all of the structured data that's in there. And when you bring the different modalities into one place, that's when AI is starting to look at the patient like a patient and not like a set of images. And that's what the doctor is doing. I think it was like 5 or 6 years ago, Google came out with a paper on radiology, and they looked at images. It made the news. It was a big thing because it was the first time where they took an AI model and compared it to radiologists, and the AI model actually performed better on these images than radiologists, which was amazing, but it doesn't give the complete picture. That AI model only looked at snapshots at the images themselves. And the radiologist has a lot more information when they do their work. And that wasn't taken into account in that study. And it's actually a much harder problem from a computer science perspective, taking in multimodal data. And especially when the data is sensitive and it's coming in from different systems, it actually makes the problem much, much tougher. And when we're able to take all of these different fields in AI and tie them together to look at the patient population in a unified way in terms of the data itself, that's going to get us to a whole new level in terms of health equity and reducing the variability of care, getting patients the best quality of care possible, and also turning it into a learning system.